In fact, people died to the point where in 2009, 4 years later, they had to retire that measure. And they wrote that when such initiatives are done, it endangers patients and may cause harm by interfering in medical practice. I had the exact quote coming in this op-ed. Now, another example, they said that antibiotics should be stopped within 24 hours of certain surgeries because they had bad science and some academician who was a little frustrated, I know the type because I used to be a frustrated academician, who couldn't get his way through real science, sat on one of these political committees and said, my opinion, we should always stop antibiotics at 24 hours. So they said, that's a good one, that's low-hanging fruit. Let's do that one, we can measure that real easy. So what they did was they go around and they say to me, a spine surgeon, you put in about 3 pounds of titanium hardware into your back. If you happen to be diabetic or any other, even a regular patient, your infection risk goes up. Say to a doctor like me who wants to get the antibiotics for 3 days instead of 1 day, non-compliant, bad doctor, slap on the wrist. Well, it took the Society of Thoracic Surgeons a year, or probably a year and a half, of politics to change it so that they could have the permission, the government permission, to give antibiotics for 48 hours instead of 24 hours. A year and a half of politics, for God's sakes. This is government-run committee medicine. I'll tell you a couple other stories, but how is this enforced? What they say is, in the Medicare pilot program, if you don't report this data to the government, which will later show up in the St. Pete Times, which happened about a week ago, we are going to hold back 2% of your pay. And they call it an incentive. I call it punishment. They call it pay for performance. I call it punish for practice. Because what happens, and I've studied this and I have it published online, you can go to doctorsforpatientfreedom.com, there will be a link there soon with a study I had published in the Journal of American Physicians and Surgeons. When they studied this, they found that not only do these pay-for-performance programs not increase quality, they don't decrease death rates, they don't make you live happier, they don't make your infection rates go down, they do nothing to improve quality. Not only do they not improve quality, and they'll never deny this, they know they don't improve quality. They actually hurt people. And they do it in several ways. They make doctors and hospitals avoid the sickest patients. Why in the world, in my right mind, if I'm a doctor, would I take a person who's seriously ill with diabetes and likely to get an infection or have a heart attack? Why in my right mind would I ever take them on as a patient and do any major operation on them if I'm going to be called a bad name in the newspaper and have a financial penalty? I'm not going to. In fact, they studied this. It's called adverse selection. In the state of New York, they published mortality rates for heart surgeons. What happened? The heart surgeons stopped taking the sickest patients. And where did they go? They went to the Cleveland Clinic. This is published in the New England Journal of Medicine. They stopped taking them. So that doesn't increase the quality of care. That simply makes you work to get your report card looking better. That's called gaming the system. There are dozens of other ways that you can game the system. This is called pay for performance. It is a central economic planning, cost control tool. And I tell you, this is the one that the Republicans are likely to compromise on. Wow. And I think it is essential that when we're holding our representatives' feet to the fire, that we say to our Republican leaders, no pay for performance, no cost control. You can read more on this if you search on my name, McKalip, at Campaign for Liberty. I've written in great detail at the Campaign for Liberty website on this topic. There's other examples. I've got a lot to talk about, so I'm not going to talk about all the other ways that pay for performance hurts people. What are other congressional proposals? Individual mandates. We will force you to buy an insurance product, and if you don't buy it, we will tax you, and if you don't pay the tax, we will throw you in jail. And I have the Joint Taxation Committee letter that verifies you will go to jail if you don't buy the mandated insurance. Now, they tried this in Massachusetts. Now, it makes sense. Why should I buy insurance when everyone else gets a free ride off of me? This is the argument they use. All these people show up and we're paying higher premiums, etc. Well, Here's the problem. In Massachusetts, what they did, it did not drive down the cost of insurance premiums. It drove up the cost of insurance premiums 10 to 12%. And in order to mandate it, they had to have a government subsidy. Because how do you tell someone who doesn't make enough money to buy overpriced health insurance, go buy the health insurance? If they don't have any money, they're not going to buy it. So what do? You create another government program to send out government checks to people to say, buy the mandated, overpriced, government-regulated insurance. And what did they do? They had a $800 million budget item in the state of Massachusetts that is now approaching $1 billion. And what did they do? They got a federal bailout. Federal Medicaid waiver, and dollars were poured into Massachusetts for this mandate. Now, never mind the constitutional issues. It's clearly, blatantly unconstitutional, which is why I support the Healthcare Freedom Act that's going through the Senate and the House in the state of Florida. Why Attorney General Bill McKalip is threatening and told the FMA board I was at last week that he will sue the Obama administration if they do this. So individual mandates, just morally, they're unconstitutional. Economically, they don't work. And just practically, they don't work. They don't drive down costs. What they do is they create rationing programs. The pay for performance rationing programs now rolling out. And here's a bigger rationing program coming. It's called a global budget. They're going to say to me, Doc, you've got $10,000 to spend on that patient over the next 90 days. This is called a global budget. They're going to force me into what's called an accountable care organization, where I have to report all my doings to the government to make sure that they're happy with me. They're going to give me a bonus. If I don't spend that entire $10,000 on you during, say, your neck surgery, I'm going to get some of that money in my pocket. What do you think? Do you think you're going to trust your doctor when they've got a financial incentive not to spend money on you? This is not money that goes into their pocket to pay for their professional services. This is money for your MRI scans, for the titanium plate that goes in your neck, for physical therapy, for any infection you might get, for drugs, for everything. So they create a global budget, and this is what's done in Canada, it's what's done in England, and in Massachusetts. They have bills in the state now because they universally covered everyone, so they claim. By the way, still 3% are uncovered. Little side note. Well, now we have to control the costs. When the government decides that everyone's going to have health insurance, they get to decide what health insurance is. They get to decide how much it costs. They get to decide what it covers. And politics rules. Every special interest group who has some sort of service to offer that's even tangentially related to healthcare, they all show up with their lobbyists and their money. We'd like some acupuncture in there. We'd like some chiropractic. We'd like some marriage counseling. All these are wonderful things. But when I buy a health insurance policy, I buy it in case I get a heart attack or a car wreck or cancer. I don't buy it because I want to get a hair prosthesis, which is in there, okay, in Florida. The costs of health insurance are up artificially because of mandated benefits that political special interest groups have put into your health insurance policies regulated by the state. And Obama claims that they're going to compromise and take the Republican proposal of interstate purchasing. Well, they can say that because they're going to make insurance be the same overpriced, undervalued, overregulated policy in each and every state. It doesn't matter if you buy it here in Utah because it's the same expensive, bad health care policy. What interstate purchasing means is that if I live in Massachusetts and I have the highest, or I think it's the 5th highest health insurance policy in the country, I can, through my freedom, buy an insurance policy from Idaho that has 13 mandated coverage benefits instead of 75 mandated coverage benefits. And I can get it for a 5th of the cost. That's illegal. Now, it's perfectly legal for the Geico Lizard or Flo the Progressive Lady to advertise and sell you auto and every other kind of insurance, but not health insurance. And that goes back to 1948 McCarran-Ferguson Act. It's a long story. It's just another failed government program.